Femoral fractures represent critical lower extremity injuries. High-energy trauma and osteoporotic falls are primary causes. Stable fixation is essential for restoring limb function. Timely surgical management ensures optimal patient outcomes. Expert femur nail stabilizes subtrochanteric, neck/shaft, femur shaft, pathological fractures, malunions, and non-unions. 3 nailing approaches for enhanced surgical flexibility. Standard and reconstruction locking for femoral shaft and complex fracture patterns. Dynamic slot enables proximal and distal compression as required. Reconstruction locking supports combined femoral shaft plus neck fractures. 120 degrees antegrade plus transverse static locking for stable proximal fixation. Anatomically contoured nail with 5 degrees proximal bend for optimal alignment. Multiple diameters, 9 to 13 mm, and lengths, 320 to 440 mm, for patient variability. Titanium and stainless steel options, left/right specific with color coding, T. Position the patient supine on a radiolucent table with the femoral head exposed. Perform fracture reduction manually under C-arm guidance before nail measurement. Position the radiographic ruler alongside the femur to measure nail length. Rotate radiographic ruler to measure nail diameter. Identify the entry point just lateral to the femoral canal axis on AP view, at the greater trochanter tip, and centered within the canal on lateral view. Place the 17/14.5 mm protection sleeve and 14.3/3.2 mm guide sleeve at the entry point. Insert the 2.5 mm threaded guide wire through the guide sleeve using the guide wire holder. Retrieve the guide wire holder and guide sleeve while maintaining the threaded guide wire in position. Create the pilot opening using the 14.3 mm entry reamer with quick coupling T-handle. Alternatively, create the pilot opening using the cannulated awl. Retrieve the cannulated awl and guide wire. Align the intramedullary canal using the reduction rod. Introduce guide wire with ball tip through reduction rod. Retrieve reduction rod. Use the AO connection flexible reamer shaft with a suitable reamer head over the guide wire. Ream and retrieve flexible reaming shaft in forward rotation. Use the medullary exchange tube to retrieve the guide wire with ball tip and insert the guide wire without ball tip. Retrieve the medullary exchange tube after the exchange. Assemble the selected expert femur nail with the insertion handle. Place nail onto insertion handle matching grooves until flush. Fix nail with nail holding bolt using 6.5 mm hex universal screwdriver with ball tip. Glide the nail assembly over the guide wire into the bone. Keep the insertion handle at the anterior side until 2/3 of the nail is inserted. Slide the handle lateral while inserting the last 1/3. Retrieve guide wire without ball tip. Assemble the connection block for connecting rod with the connection rod impactor and impactor extraction rod. Attach connecting rod assembly onto the insertion handle. Slide the hammer onto the rod and apply gentle blows to seat the nail properly. Keep the nail end 7 mm inside the bone for dynamization. Unscrew the connection rod and slide out the connecting block. Attach the proximal aiming device to the insertion handle using the locking bolt for proximal aiming bar. Position the block hole at the dynamic end and tighten with the screw. Assemble the 11/8.2 mm outer drill sleeve with the 8/4.4 mm drill sleeve and 4.3 mm trocar. Insert the assembly into the dynamic block hole of the proximal aiming device. Tap trocar to mark the drilling point and retrieve. Insert the 4.3 mm drill bit plane shank/Jacob chuck end into the drill sleeve. Drill a bicortical hole in the femur and retrieve the drill bit and drill guide. Use the depth gauge measuring up to 90 mm to measure for the 4.8 mm locking bolt. Retrieve the depth gauge after measuring. Attach a suitable length 4.8 mm locking bolt with the 3.5 mm hex screwdriver with T-handle. Screw the bolt into the pre-drilled hole. Retrieve the screwdriver and outer drill sleeve. Once the dynamic locking bolt is placed, unscrew the locking bolt for proximal aiming bar. Retrieve proximal aiming device. Attach the proximal aiming bar to the insertion handle using the locking bolt for proximal aiming bar. Attach the distal aiming bar to the proximal aiming bar while matching the marking for the selected nail size. Secure the distal aiming bar with the locking bolt for distal aiming bar. Attach the distal targeting device to the distal aiming bar with the 5 mm hex distal bolt. Insert the 10/8.1 mm outer drill sleeve with 8.1 mm trocar for sleeve into the hole of the distal targeting device. Tap trocar and retrieve. Insert the 8.1/5.2 mm drill sleeve into the outer drill sleeve. Use a 5.2 mm drill bit plane shank/Jacob chuck end to break the cortex. Retrieve drill bit and use 5.2 mm T-handle drill bit to remove debris. Retrieve T-handle drill bit and outer drill sleeve. Position 8.1/5.2 mm positioning rod through outer drill sleeve. Use the stabilizing device to maintain the jig position with the nail. Repeat the process to insert the 4.8 mm locking bolt at the distal end of the nail. Retrieve stabilizing device and positioning rod. Unscrew and remove the distal targeting device and 5 mm hex distal bolt. Unscrew and remove the distal aiming bar and locking bolt for distal aiming bar. Unscrew and remove the proximal aiming device and locking bolt for proximal aiming bar. Use the 4 mm compression bolt with the 6.5 mm hex universal screwdriver through the nail holding bolt to reduce the fracture. Unscrew and retrieve the compression bolt and universal screwdriver once compression is achieved. Use instruments to insert the final 4.8 mm locking screw through the insertion handle to secure fixation. Unscrew the nail holding bolt using the universal screwdriver, releasing the nail. Retrieve the 6.5 mm hex universal screwdriver, nail holding bolt, and insertion handle. Assemble the end cap with the 5 mm hex long screwdriver with T-handle by screwing the inner bar. Insert end cap assembly at nail's open end. Unscrew the inner bar to release the end cap and retrieve the inner bar and long screwdriver. This completes the fracture fixation with Auxein's expert femur nail. Begin early mobilization of hip and knee joint to prevent stiffness and complications. Progress weight bearing based on fracture pattern and fixation stability. Monitor healing, signs of bone union with regular radiographic follow-up and physiotherapy. Gradual return to functional activities based on clinical and radiological healing.